capacity. All right, so just another case of another, looking at it by surgeon, as far as the scheduled versus actual, which is usually the way to go about it because, in some cases, you always have a few guilty parties that may not be doing as well as others. All right. Now, availability. So hours of operation is also another consideration. If we're keeping our ORs from 7:30 to 5, are we actually utilizing all of that time? So looking at the analysis and balancing, do we need to open up additional ORs in the afternoon? Do we need to shut down some additional ORs after a certain period? And do we need to open up some more time on the weekend? So by creating these different models, you can see where your gaps are and where your opportunity is. That way you're aligning your cost structure with your demand. Okay, capacity. So again, looking at your utilization by day of week, looking at it by OR. Are we maximizing our potential with the existing space? Okay, very important. Okay, again, block utilization. So I think I've only come across one hospital that doesn't use block time. So for the most part, block utilization is usually a big component. In most hospitals are probably blocking off 80% plus of their time. Are we actually utilizing those blocks? Do we have policies in place to monitor the different physicians and physician groups to make sure that they're using that allocated time? Again, very important to look at. Cancellation. In some cases we've got hospitals that have a lot of cancellations, and unfortunately when you cancel that time, and depending on when it's canceled, in this example you can see they had a lot of cancellations within 3 days. Very difficult to actually go back and reutilize that time, so technically that's going to be lost time in most cases. Okay, then case booking. So when are we actually booking the cases? Are we doing it within 0 to 3 days versus much further in advance? This is again a scheduling function, it's discipline. How can we schedule better and get better visibility as to what the capacity is going to be required, what staff we need to have in place, etc. Okay, so what I want to talk about now is case mix modeling. So how do I actually model proposed changes to my efficiency and volume? So for example, if I wanted to change my case mix, okay, that's fine. I think that's pretty straightforward. You can look at the actual times that it takes to complete those cases. How are we performing in the current state? But the question is, if we apply those efficiency tools that I just went through, what does that do to impact our case mix? If I change my case mix, how much extra utilization do I have by reducing my turnaround times, by improving my on-time starts? So this is an example of a model that we've developed which actually helps you do that. So the areas that you see in yellow, those are areas that can be changed. So, if you have changes in your turnaround time, what does that mean as far as utilization goes and capacity goes? If I change my case mix, if I change the duration of that surgery, so how does that all impact my overall capacity and utilization? And that's what this model does. It gives you some different scenarios. You can put in hours of operation, how many ORs do I have open, hours of time, and really gives you a good picture of the impact of these improvements that we make. Okay, and then this is just an example you can see of the typical ROI benefit from working through those efficiency changes as well as the changes in case mix. So this takes into consideration case mix availability and efficiency. As you can see, over a short period of time, you can really take advantage of a lot of savings if you do all of these things correctly. In some cases, you may have certain areas you may be able to improve your efficiency without changing your case mix, and that might vary as far as what the savings looks like. But overall, you can see this is pretty impressive numbers. Okay, resources. So when we look at alignment to our capacity, there's a lot of different players within the surgical services operation. You've got your, as you can see along the bottom, your pre-admission testing through your post-anesthesia care, but also you have other components that are touching the performance of surgical services. Our ancillaries, or our turnaround times from those groups, are they holding up on-time starts? Materials management, do we have the right materials in the rooms at the right times when we need them? Do we have to run in and out of the room to grab things that should have already been there? Then you have central processing, of course. Are things being processed? Are instruments being turned around in time? Are the case cards accurate? So a lot of different components that can impact the overall operation of surgery. So this here is your strategic planning cycle. So when you look at, there's really 4 steps here. You've got the identification component, okay, the what exactly do we want to focus on. Then the diagnosing piece, okay, so that's the internal assessment. What is our current performance? And then the 3, conceiving, what should be our options, okay, and then finally the realization. How do we realize those benefits? How do we track our key metrics? So the first stage, which is the identifying phase, we actually use a tool called Expert Choice. And what this is it's decision support software, which actually helps you to make decisions based on data as opposed to, just gut feel or anecdotes. And just a couple of examples of how Expert Choice works. The first thing you need to do is set your criteria. So if I was looking at, what areas do we want to be in for our, as far as our service lines? What should be our stars, our high volume, high margin areas? What do we want to create centers of excellence for? So we need to come up with some decision criteria. So once we set our criteria, you can see there's an example there on the right. We need to put some weightings to it. Okay, that helps us to define which components are more important than others. Then what happens is you go through the system and do what are called pairwise comparisons. So I'll compare, option 1 versus option 2 versus that criteria. And it's done based on a scale, as you can see from the red. It's something moderately more important, extremely more important. And you go through this exercise with all the different criteria and all of the different alternatives. And eventually, you'll go ahead and get an output like this on the right, which will show you your prioritization. Okay, tool to use at stage 2. So this is the diagnosing stage. So there's a number of things that we do. There's SWOT, which is your strengths, weaknesses, opportunities, and threats analysis. KSF, which are your key success factors. And then finally, your competitor analysis. So you can see here, again, this is a recap. We talked about the 3 C's earlier. So doing the, what is the company, what are our core competencies, what are our customers looking for, and what is our competition doing? And making sure we understand these 3 components. All right. And then when you look at competitor analysis, who are the competitors? Okay, what are they doing? How are they doing it? Why are they doing it? What major developments do we expect? And then what are the implications for us? All right, this is an example. So this is your key success factors analysis. So when you look at what are the key success factors for our hospital, you can see on the left-hand side as an example, positive outcomes and high patient satisfaction, etc. And then putting a weight on what is that today versus what is that going to be in 5 years. And then what we do is we look at where are we as a hospital performing, that's column 4, and then what are our competitors doing. And then by looking at this, you can see where do we need to really invest our effort and our resources in order to improve in these different areas. Okay, SWOT analysis. So this is another quadrant that you can see. Many of you have probably gone through these exercises somewhere or another, but it's really identifying these 4 areas. And as you can see, in the strengths and opportunities, those are going to be the things that are helpful to achieving our objectives. The weaknesses and threats, those are harmful. Those are going to be barriers to us achieving those objectives. And then across the left-hand side, you've got your internal and external origin, which the internal is made up of your strengths and weaknesses, and then your external are your opportunities and threats. So again, another tool that helps us to determine what should be the ultimate focus of our hospital. And then this is an example of a SWOT analysis. So by going through this exercise, you can see what we're doing here is putting our different pluses and minuses, and then totaling them up across the right and across the bottom to see, what are the areas that we want to focus on. So you can see in the blue circles there, increasing emphasis on price competition, patients deferring elective surgeries. So this is just a short example of how we would apply SWOT. And then finally, on the strategic planning cycle, you've got stages 3 and 4, the conceiving and realizing stage. Again, this is really done through strategic workshops after we've completed tools 1 and 2. And you can see an example of a strategic workshop outcome. So this here is used as again, another tool to determine where are we scoring high, where are we scoring low, and another piece of information to help us make some decisions moving forward. So kind of to put this all together, this is essentially the strategic plan and modeling offering that we have. And you can see there's 4 phases to this prior to implementation. You've got the basis, so that's the workshop to define what is our strategy, looking at the data preparation. So what is our current performance? What is our capacity? What is our case mix exactly looking like right now? And then stage 3 would move into the different workshops. So looking at SWOT analysis, key success factors, to determine where should we go to market. Okay, what should be our decision? And then finally defining those actions and then getting into the implementation component of it. So that's the presentation component here. I went through that. I'd be happy to go back if anybody has any questions, but I'd like to open it up now to the group for a little Q&A based on what I just went through. And I'll just wait a few minutes and see if anyone has anything for me.
Tom, I have a couple of questions from the chat that were asked during the presentation. The first, how do you present the data to particular service lines or positions, kind of the frequent offenders, if you would? How is that?
Yeah, so there's a number of ways that typically happens, but I think the most effective way that we've used is really through the chief of surgery or the chief medical officer. Having that individual getting periodic reports, and if you have guilty parties, especially if there are multiple offenders, writing letters to that physician or physician group, is typically the most effective way. If it doesn't come from the leadership, usually it's not effective. I mean, to put nurses in a position where they have to solve physicians is usually not the best option.
Great. And the other question we had was the case mix modeling that you went over. Is that software-based or is that based in some other program?
Yeah, that's actually an Excel-based tool that we developed, and again, it's customizable, and it's really dependent on the institution on what their case mix is. But as the example showed, it really allows you to change some of those inputs and then see what the impact of those changes will be on your overall capacity.
Great, thanks. Anything? Feel free, anyone else, to open up. That's all we had from the chat section of the presentation. All right. Well, we have recorded this webinar. It will be available, posted on our website, www.tefen.com. Thank you all so much for your time. And I don't know, Tom, if you're going to go to the next slide with your contact info, if you have any questions or other considerations.
We'll send out the presentation to the folks, and that way they can they'll have our contact info on there.
Great. Well, thank you all again, and have a great rest of your afternoon.
Get out of here. There. Did you want to meet